Hi everyone, and welcome to another episode of White Coat Wednesday here at Ochsner Clinical School. I'm Emma Obermeyer. I'm a third-year medical student, and I'm pleased to introduce you to Autumn Stevenson, another third-year medical student. Autumn, can you tell us a little bit about yourself?
Sure. My name's Autumn Stevenson. I am originally from Chicago, Illinois. I'm one of the older students actually in the program, so I come from a long background of clinical research. I started doing it in undergrad at the University of Iowa, and then I continued doing it for about 19 and a half years. I also have a couple of graduate degrees, one from University of Iowa in nursing, one from Rosalind Franklin University in clinical nutrition.
So in previous White Coat Wednesday episodes, we introduced OMSA, which is Ochsner Medical Student Association here at Ochsner, and that kind of acts as like our student government. So can you tell us a little bit about your role as Diversity Officer?
Absolutely. So it's a new role this year. I am the first person to ever have this role, which is kind of nice because it's giving me the opportunity to really create this role and develop it based on what I kind of see is areas of opportunity.
Yeah.
So, of course, when you hear diversity and everything that's going on in the world right now, it's really quick to think about race and the inequalities that are going on. So that's one of the areas that I am focusing on, especially since the hospital is doing such a big push to really reevaluate their own system and see where they can improve it on. Some of the things that I've had the pleasure of being a part of is they actually just created an Ochsner institutional physician diversity council.
Cool.
And I'm the only student who actually sits on that council, so I've had the opportunity to really work with physicians in various departments who are really looking at their department and identifying areas that they can improve, identifying the areas that they do really well in. One of those people that I've had the pleasure of actually interacting with is Dr. Jose Poses, who's in the neurology department. Amazing human being. He actually, I'm going to read these things because I don't want to mess them up, has been like really big into diversity for a very, very long time. He's a chief diversity officer. He sits on that physician council that I was talking about. He's also part of the American Academy of Neurology Equity, Diversity, Inclusion Joint Coordinating Council. And he gives this amazing, amazing talk on the actual neurological parts that contribute to our biases that are unconscious. So I've had a lot of talks with him, and we're in talks about figuring out how we can take some of the things that he's doing and incorporate them into our student body so that we can better be educated as new physicians moving into the role. I've also been able to work with Dr. Apoku, who is an endocrine surgeon here, and her department is really also focusing on it. They've been doing a lot of educating. They've been reading some really great papers and trying to apply some of the things that are actually like research-based into their surgical program here. Some of the things that they've looked at are racial disparities in the use of surgical procedures, as well as like national evaluation of racial and ethnic discrimination in U.S. surgery residency programs. And then they're also incorporating like evidence-based information from like the AOA, which looked at like critical issues in education that include barriers to increase diversity in different programs. So I'm having the opportunity to really work with actual physicians, actual on-the-ground programs, and we're trying to all work together to develop something that's not just happening in the residency programs here and not just with the actual attendings here, but then using my role to kind of funnel it down to the students. So we're basically covering from end to end with really restructuring the way that we see medicine here.
It's really, truly incredible.
Yeah.
Thank you for sharing.
And then there's one more aspect that I haven't quite wrapped my mind around that I'm hoping to really incorporate is outside of just the racial identification of things. I am actually a student with a learning disability as well as ADHD, and I think that that's oftentimes a taboo thing to talk about in medicine because everybody expects you to be this very high-functioning individual, and there's these stigmas that if you have a learning disability or if you have things like ADHD or if you have test anxiety, that somehow makes you less than. And in reality, it just means that you learn differently. It doesn't mean that you can't learn. So I'm really trying to bring some awareness to those things and making it more, less faux pas to be able to say out loud, I have a learning disability, I have ADHD, and look at me, I'm still here, still doing all of these things.
Right.
So that's one of the areas that I really, really want to push as well, using this role.
Awesome, thank you so much. And so also, you started a chapter of SNMA here at Ochsner. Can you tell us kind of about what SNMA is generally, and then why you wanted to bring it to Ochsner, and then what sort of plans you have on the horizon for projects to do for SNMA?
Absolutely. So SNMA, it stands for Student National Medical Association. It actually was founded in 1964 as a subdivision of like the National Medical Association program. And what it is it's a program that's nationally known. It has chapters all over the world, actually.
Oh, wow.
And what its role is, its main mission is to really focus on minority medical students and addressing the needs of those students, as well as those trying to get into medical school, as well as the different like community related issues that are revolving around minorities and underrepresented populations in medicine. And so it's a very, very robust network of different chapters that have created all of these different programs and pathways and curriculums, and they go all the way down to grammar school. And they really focus on creating this pipeline that starts as young as possible and showing these underrepresented minorities that they can in fact pursue this career, and helping them along the way. So really holding the hand of those who may be first generation graduating from college, or don't know any physicians, or have never seen what it means to be in this field. So it was really important to me as a person who, my father didn't even graduate from high school, and me having to figure out all of these things on my own. It was really important to me that there be a chapter of this beautiful national network here at our program, so that when other people who are underrepresented, who don't necessarily know how to navigate things but have made it this far, once they get to this point, they have some support, and hopefully once we kind of get our little baby chapter off the ground, we'll be able to start really focusing as well on the community here in Louisiana, so that we can also take from the curriculum that the national chapter or the national organization already has, and applying that to our community here, so we can start reaching out to the grammar schools and the high schools and really creating a pipeline showing this community here in Louisiana that this is possible for them, and that they can also pursue this career and then even give back to their community.
Awesome. And then also, what projects have you already done through SNMA here?
So the first chapter, or the first project that we actually did, Dr. Opoku, who I spoke about earlier, is graciously agreed to be the faculty advisor for our SNMA chapter here. And she also happens to be the CFO at one of the community Ochsner community health centers that we have. So we put together an opportunity to do COVID testing for the community, and we did it in real time. Basically, she's an amazing surgeon that works here, and with whatever free time she has, she's also there in the community, serving the community. And as she saw that there were more and more people coming in, especially right after the holidays, who looked like they had COVID symptoms, she saw the needs of the community. She contacted me. She's like, what can we do? And we used SNMA to basically gather volunteers, and within a week's time, we were able to put together a testing drive-through type facility for that community. So that's the first event that we've actually done here. We're hoping to do more community-based events such as that. We're also looking to have like a journal club, and possibly a podcast that I've kind of talked to her about, where I'd be able to interview some of the physicians that I was speaking about earlier, and get some more information on what they're doing in their particular area to like really address the needs of their minority populations that they're serving, as well as get some feedback from them on, because they sit in really important roles. If you have a student who's thinking of pursuing a career like yours, what suggestions do you have for them?
Absolutely.
What things can they start doing now to really prepare themselves? So those are a few of the things that we're trying to, think about doing in the future.
Mhm.
But like I said, we just started. So right now we're trying to get our feet on the ground.
Well, it
so.
sounds like you're off to a great start. And that project was really great, the COVID outreach
Yeah,
one.
thanks for coming. I really appreciate it.
Thank you for hosting it. It was
Yeah.
really well done overall. Tested a lot of people.
We did test a lot of people.
It was great. And then last question, if you could offer a piece of advice to anyone who's thinking about pursuing medicine, especially someone who may be underrepresented in medicine now, what advice would you like to give them?
Honestly, close your eyes, open your arms, and leap. That's what I would say. There's nothing that you can do really to wrap your mind around or prepare for it. And the harder you try, the more you're going to be let down. So just trust yourself. Don't be afraid to ask questions. Reach out to any and everybody one thing I have found is people are really willing to answer questions if you ask them.
Mm-hmm.
So really just 10 toes down and go for it.
Awesome. Thank you again for interviewing with us. So thank you again for joining us here at White Coat Wednesday at Ochsner Clinical School. I'm Emma and this is Autumn, and we hope to see you next time at White Coat Wednesday.